Kazadi, yoga therapist, and I'm going to give you a few general tips about how to take care of a stiff low back. If I just had one tip for you, it would be this. So finding a modified squat. I'm sitting on a block, you might be higher. Get your back to the wall until you feel like your lower back is releasing. But say you wake up in the morning and your low back is stiff. Before you even get up, do the simple things that you know from your yoga class. So hugging your knees into your chest, gentle little movements. Use your pillows. You've got lots of props. You're in bed. Hopefully you're not on the floor. When you get up, draw your navel in. Use your hands to support you. So you're not bending at your waist as you come up. And then go take a long hot shower and really let the muscles warm up and relax. And then when you go to your yoga class, and do go to your yoga class, you might have to modify. So I'm using my hands on my thighs as I come up and down. I'm lifting my navel as I come up and down. You want to start on your back. So if you don't have props, the feet wide, the knees knock in. It just takes the pressure off of the lower back. And then when you're doing your abdominals, you're going to push your lower back into the floor. So this gets the lowest part of your belly turned on, and it will also keep your spine from waggling around and then grabbing and getting into more tension. So keep the belly drawing in, keep the lower back pressing down, no matter what you're doing with your abdominals. And then when you come up on the exhale. Keep drawing your belly in towards your spine. Use support if you need. If you happen to be in a flow class, if that's your thing, then just remember that as you exhale and you come into a forward bend is at the pelvis, it's not at the waist. So you want to be moving on an exhale, lifting your navel up strong. I've got my feet a little wider than I normally would. My knees are a little bent. Again, that makes it a little easier on the back as you come forward, moving on the exhale. Same thing with the standing poses. So we're used to opening up on the inhale, but just while the back is stiff, it gives you a little sense of a corset and a stability for the lower back. If you're in your standing pose and it feels like your low back is compressed, tip your pelvis a little bit. My spine is long. My spine is neutral. I've just let my pelvis come forward so that my warrior one doesn't compress my low back. So the same thing, when you come into your back bends, the more I'm trying to open up my chest, the more I've got to use my lower belly so it doesn't end up in my lower back. So the bigger the back bend, the stronger the core. And then when you come to your finishing poses, stretches at the end of class, for now, do them on your back. It will keep any sense of strain from returning to your low back. You'll get the range of motion and opening that you want without any further strain on the back. And then for Shavasana, just take your feet wide, let your knees knock in. That will take the pressure off the lower back. Maybe take your hands to your lower belly. And then as you get up and you move about your day, move about your day. So the back will get stiff the more you're still. So whether you're sitting in an office, doesn't matter what you're doing, just simple movements will keep your back from locking up. If these tips aren't enough, if this doesn't work after a few days, then you need to see someone who specializes in low back care. And whether that's a doctor, a yoga therapist, someone who can look at you and give you specific tips for what you need. There's no reason to live with low back pain. Namaste.